Hi, everyone. Good morning. My name is Mikel Lejean. I'm the Associate Campaign Director at Corporate Accountability, and today we're honored and grateful to be able to come together with these experts and advocates for public health and tobacco control. I want to first thank all of you for joining us. I also want to welcome and thank our panelists who will outline in their presentations the way that Philip Morris International, as a part of the broader set of big tobacco corporations, continues to exert its influence by delaying action, misinforming the public, and circumventing responsibility, ultimately continuing to addict generation after generation to tobacco products. Today, we have advocates from 3 regions who will be sharing examples of PMI's tactics and their recommendations for the path forward for public health and justice. We have Dr. Ulysses Dorothy, Executive Director at Southeast Asia Tobacco Control Alliance, who will spotlight the operations of PMI in Asia and its continued cigarette expansion into the Global South. Philip Jablow, Programs Director at Corporate Accountability and Public Participation Africa, CAPA, will share with us the spotlight on Nigeria and the circumventing of tobacco control laws by PMI. Dr. Eduardo Bianco, Framework Convention Alliance Regional Coordinator for the Americas, has a presentation prepared on how strong public health laws have impacted the tobacco prevalence across Latin America and how Uruguay stood up to PMI's intimidation via litigation. Adriana Carvalho, Legal Director at ACT Health Promotion in Brazil, focuses on the history of misinformation by PMI and how a legal case in Brazil sets the stage to recoup the cost of these lies and the impacts on public health. Danielle Dorado, Senior Latin America and International Policy Organizer at Corporate Accountability, will focus on the CSR activities of PMI that disguise the true nature of its operations globally. I want to open by acknowledging the backdrop in which this virtual briefing is being held. The world, governments, people, global institutions are adapting to a rapidly shifting crisis. The crisis is no equalizer. It further exacerbates the already existing inequities in the world, and COVID-19, a respiratory disease, should be a galvanizing moment to prioritize public health and people over profits. What we've seen instead is transnational corporations, from fossil fuel industry to food and beverage to tobacco, seizing this moment to maintain profitability at all costs. Tomorrow, PMI will tout its commitment to public health, when actions speak differently of the past 2 months in the midst of this respiratory crisis. In Ukraine, it's partnered with an app to get nicotine in the hands of people in lockdown, put their employees at risk in order to keep producing and profiting, muddied the science, and helped support the spread of misinformation at a time when accurate information is the most needed right now. Public health officials have warned against the use of tobacco products in this time, yet PMI continues to manufacture, market, and distribute its products. This is the latest in a long line of examples of how PMI has endangered public health from spreading a generation of misinformation to furthering the deadly tobacco epidemic, which continues to kill 8 million people annually. At the root of this epidemic is big tobacco, with PMI as an industry leader, which continues to be the single greatest threat to implementation of the Global Tobacco Treaty. I hope that governments see clearly that this industry has no intentions of slowing down, even with every reason to amid the COVID-19 crisis. PMI will never voluntarily hold itself truly accountable. That can only be done through government action and mandatory regulations free of industry influence. The seismic shift that will positively impact public health and the tobacco control movement is the call for liability, holding the industry legally and financially liable for its destructive business. Through our panelists' testimonials, I hope you'll see clearly just how big the scope of this call of liability is. Before we get started, just a quick note on logistics. Chat function is at the bottom. Click on that to share your questions for the Q&A period later. We will compile and make sure we can answer as many as possible and manage time best. I don't want to take any more time and actually want to just start by passing it over to our panelists to get things going. First up is Dr. Ulysses Dorothy. Yul, take it away.
Thanks, Mikel, and good day to everyone. As Mikel mentioned, my name is Ulysses Dorothy. I'm a Filipino physician living in Manila, and I represent the Southeast Asia Tobacco Control Alliance. Over the past 30 years, I've met many tobacco victims, majority of whom began cigarette smoking in their teens, attracted by Marlboro and other cigarette advertisements and whose lives have been forever transformed by their addiction. Some of them have died prematurely from tobacco-caused diseases such as heart and lung disease and cancer, and others now live with lifelong disability. In recent years, Philip Morris has been talking about its company's transformation and of unsmoke and is rolling out heated tobacco products in many countries, such as the Philippines, promoting them as significantly less harmful alternatives to cigarettes. After many decades of denial, Philip Morris has finally conceded that cigarettes are harmful and that people should stop smoking. However, it is misleading and hypocritical to claim corporate transformation if Philip Morris, now admitting cigarettes are harmful, continues to make these same harmful cigarettes, continues earning most of its profits from them, and continues opposing stringent tobacco control measures aimed at reducing cigarette use. While talking about transformation, Philip Morris continues to sell cigarettes to teenagers and poor people on the streets of Manila and throughout Asia. While claiming to promote a smoke-free future, Philip Morris sued a small town in the Philippines when the city council passed a smoke-free ordinance and a tobacco-free generation ordinance, both of which were aimed at protecting its young people from cigarettes. If its claimed transformation were genuine, Philip Morris would be voluntarily taking responsibility for selling these harmful products by implementing a global product recall for cigarettes, retracting its opposition to strict tobacco control measures, and compensating its customers who became sick or died prematurely or suffered daily with tobacco-caused disability. But we know Philip Morris is doing none of that. Even during this ongoing coronavirus pandemic, Philip Morris continues to make and sell cigarettes, completely disregarding warnings by health authorities, such as the World Health Organization and our own Philippine Department of Health, both of which have warned that smokers are more vulnerable to being infected by the COVID-19 virus and have an increased risk of severe COVID disease and death. At the same time, Philip Morris is donating face masks and other equipment in an attempt to cover up the millions of tobacco diseases and deaths instead of doing the one thing that really matters, which is stopping selling cigarettes. Continuing to sell cigarettes that can increase smokers' risks of severe disease and death from COVID-19, rather than using this pandemic as an opportunity to stop making them and thereby encourage smokers to stop smoking, just shows how much Philip Morris cares about its customers. In the Philippines, at least 107,000 people are killed by cigarette use each year. In Southeast Asia, there are 500,000 tobacco deaths annually, and apparently a few hundred or thousand more smokers dying from COVID-19 do not matter to Philip Morris. So we challenge Philip Morris here in Asia to stop the duplicity, stop marketing and selling cigarettes, accept liability, pay damages to tobacco victims, compensate governments for medical costs, and clearly specify a date to completely phase out all tobacco products. Thank you.
Thank you so much, Yul. What a powerful way to start our panel. I'm now going to turn it over to Philip Jablow from Kappa.
Thank you, Michelle. My name is Philip Jablow. I work with Corporate Accountability and Public Participation Africa. I'm based in Nigeria. Nigeria is a country of population of about 200 million people, which makes it the most populous nation in Africa and the most populous Black nation in the world. Nigeria's tobacco control law came into force in 2015, but its enforcement has been very, very poor. It is estimated that every year more than 17,500 Nigerians are killed by tobacco-related diseases, Over 370,000 of our kids and more than 4.3 million adults use tobacco each day. We are not wrong when we say that Philip Morris International views Nigeria as a very, very attractive investment destination. The managing director of PMI Nigeria subsidiary, Mr. Costa Rica, described it so in an interview in 2017, and he's not wrong. For PMI, being able to get away with clear infractions and hiding behind proxies to manipulate established government systems can truly make an investment destination attractive. PMI broke into the Nigerian market in 2015 by first circumventing the country's tobacco control law, which mandates tobacco companies or individuals intending to manufacture, import, or distribute tobacco products to first obtain license from the Minister of Health to do so. Rather than go through this clear and legitimate route, PMI went around the bend and applied through Senegal, another country, to benefit from what we know as the ECOWAS trade liberalization scheme, which allows free movement of goods across all states of West Africa, including Nigeria, with limited checks. And through this backdoor deal, it was able to quickly move 122 million units of cigarettes into Nigeria to further burden our precarious healthcare sector. After that deal, which effectively clipped the wings of the Nigerian government to hold it accountable to the Nigerian people, it has perfected the art of operating in the shadows in virtually all sectors using proxies. For want of time, we can cite a few examples. It is public knowledge that PMI is behind the Foundation for Smoke-Free World. That foundation is now in partnership with Nigeria's prestigious University of Nigeria in Nsukka to sponsor agricultural research, which also makes PMI a stakeholder in Nigeria's agri sector. In Nigeria's educational sector, the Conrad Foundation, which receives funding through a partnership with the Foundation for Smoke-Free World, targets school-age children for career advice and internship. Conrad Foundation organizes a yearly contest in Nigeria, with the winning pupils receiving scholarships worth about $60,000 for 4 years to study at prestigious universities abroad. And because of this, many of our kids now look onto this foundation funded by the Foundation for Smoke-Free World to give them entrepreneurial advice and guidance. PMI is also exploiting the COVID-19 pandemic and continues to spread in Nigeria its products. The Nigerian government opens its arms to donors and philanthropic organizations, and PMI has again showed its hands through this initiative, working with the International Tobacco Company, the local manufacturer of its many brands, which recently donated 10,000 sanitizers to one of the states in Nigeria where it is manufacturing its products. And through these schemes, PMI remains in the shadows, yet is actively pulling the strings to remain relevant in Nigeria. Because of this, we want PMI to stop circumventing our tobacco control laws. We want PMI to stop hiding behind proxies to compromise all sectors of the Nigerian economy. And PMI must take full responsibility for the arms of its products. Thank you very much.
Thank you so much, Philip. Now we're heading to the Latin America perspective, and starting with Dr. Eduardo Bianco.
Thank you, Miguel. Good morning. My name is Eduardo Bianco. I'm a cardiologist based in Uruguay, working on tobacco control for over 20 years and serving as the Farm Convention Alliance for Tobacco Control regional coordinator for the Americas. I'll briefly speak on my region, Latin America, and on my country, Uruguay. Before 2005, when WHO Framework Convention on Tobacco Control, the FCTC, was ratified, very few Latin American countries had implemented significant tobacco control policies, despite that the tobacco epidemic was a huge problem for the region. After 2005, things changed, and progressively, countries have implemented FCTC measures, and smoking prevalence dropped from 22% to 17% in 10 years. But tobacco is still a problem. It causes around 1 million deaths annually in the Americas. On average, it costs 0.7% of GDP and 8% of the national health expenditures in Latin America. Meanwhile, tobacco taxation revenues barely cover 35% of direct medical expenses related to tobacco. Additionally, the region is far from the full FCTC implementation, and that implementation is uneven. What is the main obstacle for the countries to reach the full FCTC implementation? The tobacco industry interference. Moving to Uruguay, a small Latin American country with less than 3.5 million inhabitants. In 2000, it was one of the Latin American countries with the highest tobacco consumption prevalence, with the highest lung cancer death rate in men, and the highest chronic obstructive pulmonary disease prevalence at the region, both highly related to tobacco. About 5,000 people died annually due to tobacco-related disease. After 2005, Uruguay implemented most FCTC measures and sharply decreased adult and mainly youth tobacco consumption prevalence, as well as decreased health consequences related to tobacco. For all of that, Uruguay became an international tobacco control leader. And because of that, Uruguay also became a target for PMI. The 2010 total annual tobacco companies revenue in our tiny country was about $100 million. And PMI just had less than 20% of the market. On that year, PMI initiated a historic arbitration case at the International Center for the Settlement of Investment Dispute of the World Bank against Uruguay. Then PMI complained about Uruguay's 80% health warning levels on the packaging and for the single presentation requirement. What was behind this action from PMI? The money they were losing in Uruguay's market? No, it was to force Uruguay to set back and for scaring other developing countries from preventing them to implement similar measures. Finally, Uruguay won, but it had a cost. It delayed FCTC implementation for almost 5 years. What did we learn from the arbitration decision? PMI claimed that Uruguay regulations were arbitrary, constitute an expropriation of trademark, and so on. The arbitrators rejected all PMI claims and found that Uruguay measures were reasonable and evidence-based, and ordered PMI to reimburse Uruguay for legal fees and other related costs. Up to now, many countries have been targeted with legal action by the tobacco industry for market expansion. I believe it's time for all the parties to put in practice FCTC Article 19, which is about liability. It is time for parties to be on the offense and follow the example of South Korea and Brazil that are suing multinational tobacco companies to recover health costs due to tobacco. It is time for applying to big tobacco the polluters pays principle. Thanks.
Thank you, Eduardo. Now I'm going to pass it over to Adriana Carvalho.
Good morning. My name is Adriana Carvalho, Legal Director at ACT Health Promotion, based in São Paulo. In addition to the smoke epidemic, which kills more than 8 million people worldwide each year, PMI offers the way for another epidemic. The strategy is investing in new technologies, electronic cigarettes and heat-not-burn tobacco products, such as IQOS, and sell them as less risky products. This is the same deceptive strategy adopted in the 60s with light and mild cigarettes, and the same logic for profiting at the expense of life and addiction. These new products contain nicotine, thus they are designed to maintain or cause addiction. They have a strong technological appeal with flavors that make them more attractive to children and young people. In countries like Colombia and in Italy, there is intense advertisement to teenagers and young people on social media and with digital influencers, promoted to all audiences at parties and Christmas fairs. Although in Brazil, sales and advertisement of these new products are prohibited, there is a misleading campaign currently running through the website We Need to Talk by PMI and its Brazilian subsidiary, Philip Morris Brazil. It's clearly an advertisement to introduce IQOS and other PMI electronic smoking devices. Complaints were made. There is a powerful lobby from PMI's subsidiary and other tobacco companies in Brazil to change the law. Whereas there is a consensus in the health field that law must not be modified and the new products will put at risk the successful tobacco control program recognized by WHO due to a great reduction on the number of smokers. Especially in Brazil, the PMI subsidiary must immediately seize the powerful lobby to prevent regulatory practice, comply with tobacco control laws, and do not use the judiciary branch to invalidate proven effective public policies. Although smoking worsens the symptoms of the COVID-19, during the quarantine in Brazil, PMI subsidiary increased the manufacture of cigarettes and created a new working shift, increasing the displacement of workers. PMI's business is the manufacture, sale, and promotion of a highly addictive product that causes more than 50 diseases, which has been known by the company since the 60s. However, the company continues to invest in the business and profit, placing a burden on the health system of countries due to the costs of tobacco-related disease treatment. It's past time that PMI must be held responsible for the negative externalities that its business causes to health systems worldwide, in compliance with Article 19 of the FCTC, an international public health treaty, which states that countries should promote big tobacco civil liability. In the United States, PMI and other cigarette companies have paid this bill for 20 years to all states through court settlements. In total, over 162 billion has already been paid, and more will be paid in perpetuity. In Canada and South Korea, this bill is charged but has not yet been paid. In May 2019, Brazilian attorneys general filed a lawsuit against BAT, PMI, and their subsidiaries in order to recover costs incurred to treat sick and dying cigarette smokers. Research identified that the collection of taxes on cigarettes is far less than what's spent by the health system, which is equivalent to 1% of the national GDP in Brazil. It's very important that international headquarters are also held accountable as they profit from the business and control Brazilian units. The right to profit must come alongside the duty to fully repair the negative externalities that the business causes to the country's health system. Thank you very much.
Thank you, Adriana. Last, we'll have Daniel Dorado.
Thank you, Mikel. Hello, everyone. My name is Daniel Dorado. I am the Senior Latin America and International Policy Organizer with Corporate Accountability. I am a lawyer specialized in public health, liability, and human rights, and I am based in Quito, Ecuador. In April 2019, Philip Morris International PR declared Year of Unsmoke. Philip Morris International continued to seize opportunities to profit of the growing opposition to cigarettes through making sure claims like unsmoke and smoke-free are everywhere, including by marketing IQOS. In marketing IQOS, PMI is skirting regulations and even going as far as violating national tobacco laws. In an interview July of 2019 with PR Week, Marian Salzman, Senior Vice President of Global Communications, stated, once IQOS is legal for sale in a country, PMI immediately stops marketing cigarettes. A claim that PMI didn't stick to when IQOS launched in Israel and Romania and has continued to avoid with its most recent IQOS launches. In February of this year, Philip Morris International went so far as to boast out the more than 700 billion cigarettes sold and how Marlboro cigarette shares were at an all-time high. PMI's public relations machine may be trying to sell the world a delusion that they care about public health, but the actions tell the real story. PMI is a corporation that will continue selling cigarettes as long as it can turn a profit. PMI also relies on a network of influence to push its priorities, from the PMI-funded Foundation for a Smoke-Free World and its grantees to its network of industry-friendly affiliates that have attempted to co-opt the COVID-19 crisis. Since the 2017 launch of the PMI-funded Foundation for a Smoke-Free World, it continues to be just the latest in a long time of empty promises, flashy PR initiatives designed to distract people and governments from the truth. Philip Morris International's bread and butter is marketing and selling tobacco, a deadly poor product that claims millions of lives every year. PMI is trying to normalize the harms of tobacco use through its corporate social responsibility programs, promoting new tobacco products like IQOS. A key figure for the foundation and PMI's priorities has been a major center of excellence grantee in New Zealand. Last year, the grantee of the foundation raised concerns over a common sense public health measure in New Zealand to stop smoking in cars, going so far as to state that second-hand smoking packs are exaggerated. At the same time, PMI New Zealand attempts to gain access to a major Auckland poverty group in a bid to get its new tobacco products marketed to poor people. Loving key figures in the Ministry of Health and approach South Auckland's County's Manukau District Health Board in an attempt to give away its IQOS smokeless tobacco device. The Foundation for a Smoke-Free World and its grantees continue to operate with a veil of secrecy as to the extent of corporate priorities its activities advance. The original reassurances from the Foundation have been put to rest. There's been no new funders, unlike the original assertions to the contrary. As recently as April 2020, Philip Morris International continues to be the only source of funding. After years now of the announcement from the public community health, the WHO, higher education institutions, and research institutions, the foundation has instead turned its attention to funding grantees that advance industry-friendly priorities in country. The most valuable resource in the response to COVID-19 is accurate information and time, serving as a potential proxy for PMI's interest. The Foundation for a Smoke-Free World has granted money to individuals that are spreading misinformation that could increase the spread and impacts of the pandemic, while wasting valuable time of public health officials in having to correct and reassure their citizens of the highest level of health response. PMI has done everything to keep manufacturing open until it's no longer feasible, while promoting its empty CSR and voluntary support. PMI isn't serious about unsmoking the world. It clearly isn't serious about public health and would rather fund a foundation that continues to put money toward individuals that benefit tobacco corporations' profits and public health at risk. Thank you.
Thank you so much, Danielle, and thank you to all of our panelists for such incredible presentations. I now want to open it up for the question and answer period. And just to state again, down at the bottom, we're using the chat feature to compile and share those questions with our panelists. The first question that we have is, are there any specific examples from your countries of Philip Morris exploiting the coronavirus crisis to improve their image or lobby the government? Adriana mentioned the manufacturing facilities changing their times and shifts, and also the impact that has had on workers in Brazil. I mentioned earlier how Philip Morris has actually turned to an app in Ukraine to deliver IQOS devices to people that are in lockdown. There was also in Bologna, Italy, 3 days after Italy's highest death toll, Philip Morris temporarily suspended operations in that manufacturing facility, revisiting on a weekly basis whether or not they could open up, even though most measures said that there was months ahead until Italy should reopen those states. And I also saw that Philip and Eduardo have already started to chime in, so maybe, Philip, you can give the verbal example from Nigeria first.
Okay, thank you, Michelle. Like I mentioned earlier, in the case of Nigeria, Philip Morris has been acting in the shadows using proxies. In relation to the COVID-19, Philip Morris has also been very, very active. Philip Morris has a manufacturing agreement with the International Tobacco Company in Nigeria. So the ITC, which is the acronym of the International Tobacco Company, manufactures PMI brands in Nigeria. That arrangement started in 2017. Just on March 31st, ITC donated 10,000 sanitizers to the Kwara State government. Ironically, Kwara not only sanitizers, it also gave the state government 7,400 face masks. So this is one of the ways that Philip Morris, like I mentioned earlier, continues to hide behind the scene, but it's actually pulling the strings. And the COVID-19 has served as an opportunity for it to continue doing what it knows best, using proxies.
Thanks, Philip. And Eduardo, you had an example from Costa Rica, correct?
Yeah. Recently, on April 16, a news from the newspaper showed that PMI donated 40,000 N95 masks to protect against COVID-19 to the government for the healthcare workers. And this is really using this opportunity to present themselves as a good citizen when they are producing or making products that use it as intended. It increased the risk, increased the damage with the patient with COVID-19. So the right thing should be advise all the smokers to quit smoking in this epidemic in order to prevent further damage, a great damage to the population, not to provide masks to the people. This is really, I don't know what the word to use. I left to you.
Hypocrisy is what I would go with. And then, Yul, did you have examples from Southeast Asia?
Yeah, in the Philippines, Philip Morris has a joint joint company with the local cigarette company. So it's Philip Morris Fortune Tobacco Corporation. They donated face masks, other PPEs, as well as alcohol, water, and all for corporate social responsibility, and even through other foundations, so not directly. and this is both to local governments and to national agencies. And in Indonesia, they've also donated, also through a different foundation, similarly face masks and even funds. So it's really an attempt to show that they are humane during this time of the pandemic, when obviously it would be more humanitarian to just help people stop smoking.
Thanks, Yul. And Adriana, are there any other examples from Brazil, or do you want to expand on the example that you noted before?
Yes, in fact, what I'd like to highlight is that, of course, that in the pandemic situation in which we are, it's important to have help. Any help is very important for governments. But what we must see in the case of the tobacco industry, specifically in PMI and its subsidiaries, is that they have a history of denying, omission, and marketing to kids. And it's very clear and proven that they cause damages to the health systems in each country in which they do business. So instead of giving masks and other stuff like that for the COVID-19, they should pay the bill to reimburse the states. So then the government will be provided by resources to deal with the pandemic situation. My question is always why Philip Morris and other tobacco companies pay the bill in the United States and they don't do the same in other countries. We are talking about the same tobacco, the manufacturers, and we are talking about the same products, and of course the same effect on the health people. So they should pay this bill instead of making marketing to promote their images in order to trying to improve their images before the public. They should pay the bill for the externalities that they cause to the health systems. Thank you.
Thanks, Adriana. And I think that Dani might have an example in Ecuador that speaks to how using this COVID crisis and pandemic to roll back certain regulations or how governments are dealing with the tobacco industry even before this crisis had started might be a good way to mention that perspective. And then I think another question, Dani, if you feel comfortable answering, is do you think that PMI and the industry can change course, or is it all of this wrapped up in marketing? So I don't know if you want to answer both of those questions.
Thank you, Mikel. So briefly, I want to share an example of how in the past weeks in the Ecuador Congress, there was a project on how to counteract smuggling. And of course, tobacco industry has been an active part of the initial discussions. Using arguments, for instance, on how if the government really push forward in this project, could have the additional resources to face the COVID-19 crisis. It is so frustrating and indignating seeing some of the arguments of how they present how smuggling is affecting their business and profits, while the discussions continue, and of course, congressmen are actively hearing, well, tobacco industry and other industry that of course has been affected. But the question that I want to just put on the table is, at which cost do governments need to listen this type of industries to find resources to face the crisis? Should we put balance between public health and facing how industry use these tactics to undermine public health policies to create an image, and more or less how Eduardo framed it, and to put it in some kind of words, using hypocrisy to approach and continue securing the policies that could allow them to continue gaining profit? And regarding to the second question, can you please reframe it again?
Yeah. Do you think that PMI can and the industry can change course, or is this all marketing that we're seeing?
Well, absolutely. I think that what all my co-panelists has shared is an example that there is no way at the current stage that they have intentions to change their course, no? Tactics and more or less how they are using some of the concepts of smoke-free world is just, or what evidence has demonstrated is a use of reframe marketing tactics in terms of continue approaching governments, in terms of continue presenting young science, in terms of continue encouraging some advocates to see some way industry is friendly and that they have solutions to, for instance, how they are using COVID-19 with the examples Philip shared from Nigeria, with the examples Jules has shared, Adriana and Eduardo. I think that there is no way that we can infer these friendly intentions to change. And nevertheless, I think that I could say that all these marketing strategies that they are using at the current crisis shows one more time how they are trying to attempt to public health policies.
And Yul, in your experience with PMI in Southeast Asia, do you think that they can change course?
I think I would agree with Danielle. The experience we've had in the region is that it's business as usual for the tobacco industry, despite their promises of trying to promote what they claim are less harmful alternatives to cigarettes. And they've made this claim over the past 5 or 6 years now. They continue to sell cigarettes, make their business out of it. And we actually even have a survey where we looked at the IP offices in Southeast Asia in 5 countries. And Philip Morris has been applying for a trademark for many of its products, including cigarettes, as well as heated tobacco products and e-cigarettes. And lo and behold, the survey showed that majority of their trademark applications are still for cigarette brands. If they were serious about trying to transform and shift people to supposedly safer alternatives, would they not be trying to brand more of these new products and stopping trademarks for cigarettes? They're not doing that. So we really can't believe what Philip Morris is saying because their actions do not support their words.
Thank you. Another question we have is about Eduardo and Adriana, I think both shared successes in Latin America. And I think that one thing that's really important to note is that the state of a tobacco corporation, a cigarette corporation, deciding that they're going to talk about anything but cigarettes is a huge shift in marketing. And that has to be credited to public health institutions, to tobacco control advocates. And I do want to speak a little bit to the successes that we've seen. So Eduardo or Adriana, either one of you want to share more about the successes that you've seen in Latin America, and then maybe we can open it up to Philip and Yul as well.
Well, despite the opposition mainly from the multinational tobacco companies, BAT and PMI, tobacco control policies in Latin America along the last 10, 15 years have been growing. And as I said before, tobacco consumption prevalence is decreasing, not as fast as we would like, or even what we could do, because if we could implement a full FCTC implementation, for sure, now we will have a minor prevalence in tobacco consumption prevalence in adults and in youth, but the interference, the tobacco industry interference is preventing us for doing that. Not just with e-cigarette, but also raising the topic of a tobacco illicit trade for preventing to increase tobacco taxes. That is the more important measure, tobacco control measure for decreasing smoking. Anyway, we have in many countries that are increasing tobacco taxation. Most of the countries are smoke-free. In South America, for example, almost all Latin American countries, most of them have at least 50% health warning levels. So we are doing a very good progress despite the huge and great opposition from the industry.
Can I add some information from Brazil? So yes, we have a great reduction of the number of smokers, particularly since the beginning of the 90s up to today. So we were talking about 35% of the population in the early 90s, and now we are talking about 9.5% of smokers, which is a huge difference. And it's all due to the public policies on tobacco control, particularly since the 80s, and which was improved when Brazil ratified FCTC. But we have a long way to go in another public policies like plain packaging and the tax increase, for example. And but in general, we can say that the tobacco control program in Brazil is a successful program, and that's why we all the health field in Brazil, the Brazilian Medical Association and other medical associations too, and the civil society that works on tobacco control, we are working to not to the law that prohibited the new electronic products be maintained. So we don't want this change, but we have now, which is it's a result of the work of the last 30 years. We have a denormalization of smoking in Brazil. So the new electronic products will increase, will bring back, in fact, the normalization of smoking. Oh, you can say, oh, it's vaping. No, in fact, it's smoking because it's an addiction too. So it contains nicotine. So we are talking about smoking in fact. So although you change the name, we were talking about the same thing. So this new, taking the example of the United States and other strategy that we say, for example, as I said, in Colombia, so they market these new products to children, to the youth. So, and now we don't have these products like currently sold in Brazil. So it must be kept prohibited in order to keep or increase the denormalization of smoking in Brazil. Thank you.
Well, in Nigeria, like I mentioned, we have a National Tobacco Control Act in place. That was in 2015, but that law also has a loophole, which is that there should be regulations for enforcing the act. We succeeded in ensuring that that regulation is put in place, and that happened December last year, 2019. But the greatest snag is tobacco control is not funded in Nigeria, and as such, this is a loophole that the tobacco companies like Philip Morris have exploited to start engaging behind the scenes with government agencies that are supposed to enforce the Tobacco Control Act and its regulations. So the industry has, of course, used this to exploit targeting kids, and of course, some form of engagement with the Ministry of Agriculture, the pools are stakeholders in the agri sector now by donating a lot of things to the Ministry of Agriculture, to farmers across the country. But we know this is just a strategy of weakening enforcement ultimately when it starts, because these agencies of government start seeing companies like Philip Morris as partners in the agri sector, partners in the educational sector. But advocates are still working, and we are pushing most critically that in the short term, prior to when enforcement proper will start, for instance, there's ban in sale of cigarettes in single sticks. There's the ban on smoking in public places is put in place. These ones do not actually need so much of funding to do. It is just citizens engagement, getting citizens engaged in understanding what the law is all about, so that there's citizens enforcement. If you have a premises where people want to smoke, you can raise the alarm and things like that. So that's where we stand at the moment. We have the law in place, but the enforcement proper has not started, and this is the loophole that companies like Philip Morris are exploiting.
Okay, thank you all. There's one more question before we wrap, which is actually focused on how in the Philippines there's been a shortage and closures of vaping stores and supplies. Are there any other examples in where you are in your countries that is similar, or that there's shortages of tobacco supplies or vaping products?
I don't understand the question really, if this is talking about these products are in fact less dangerous than the cigarette, and so banning or preventing their sales is something wrong, or maybe it's my language limitation for that. But if that was the question, just to raise the point that there is a growing evidence that e-cigarettes are causing damage to the respiratory system and to the lung, and is not confirmed that is useful for quitting smoking. In most of the South American countries, e-cigarettes are banned. We ban the selling e-cigarettes, and those who allow to sell this are having a lot of problems with this product. I don't know if I understood the question. I do apologize to the one who raised it.
No worries. I think just to clarify, it's that because of the lockdown, there's been shortage of supply in the Philippines in particular with vaping products. And just wondering if, because of the lockdown, if there has been, maybe Adriana, you can speak to this, if there's been a shortage of supply in Brazil because of the lockdown measures.
Illegal.
In fact, we don't have lockdown in Brazil yet. It may happen soon, I believe. But cigarettes are selling normally. There is no restrictions on that. The restrictions is the same for for minors and things like that. But there is no restrictions for sales.
Good. So just in closing, I want to thank all of our panelists. Oh, sorry, go ahead, Yul.
I think Adriana could also say that, and she mentioned earlier that e-cigarettes are actually banned in Brazil and have been since 2009, I believe. So even before the world caught on with e-cigarettes, they were already banned in Brazil, which I find quite interesting because they have been successful in bringing down smoking prevalence in Brazil to single digits. I think at the moment it's below 10%, without any of the vaping that many countries that are promoting vaping for smoking cessation are claiming as a success. So in the Philippines, and I've read the question, there are actually supplies being sold online and also by courier, but these are actually not allowed since they're not essential products. And they actually require registration with the government, which I believe has not yet taken place. So it's a very fluid environment at the moment in terms of vaping. But what I would like to point out is that, you know, you talked about successes in various countries, and in our own region, we have had similar successes here and there. So there are countries where before there was no tobacco control legislation, now they do have legislation in place, but we don't have any single country that is fully compliant with the provisions of the WHO Framework Convention on Tobacco Control. Cigarettes are still cheap in many countries. Our Philippine graphic health warnings are only half of the package, whereas in other countries they are much larger, 75, 80, 85%, and the largest is 90%. We still have smoking in many public places in many countries in Southeast Asia. Advertising is rampant in Indonesia, which is not a party to the treaty. So despite having these successes, I would say the tobacco companies are still several steps ahead of us. So we shouldn't be looking at just the successes, but looking at how these tobacco companies, particularly Philip Morris, has been blocking government attempts to strengthen their tobacco control measures. And I think that brings us back to this whole issue that we are trying to address tomorrow during Philip Morris's shareholder meeting. We are being sold this story about Philip Morris being part of the solution, but let's all remember that they are actually stopping us from implementing the solutions contained in the FCTC.
Yul, that was my wrap up. So we're like done now. It's perfect. So thank you everyone for joining, our panelists, for the folks that joined on this call. Tomorrow, as mentioned, is the PMI shareholder meeting where many of us will be in the room trying to share our questions with the executives of PMI. Likely, we'll hear a different smattering of answers that may not actually answer the questions that we pose, but we're going to be there to speak truth to power, to talk about the real impacts of PMI's business operations all around the world, and to advocate for a world that is truly in alignment with the gold standard for public health and tobacco control, which is the WHO FCTC. So I want to thank all of these fervent advocates for tobacco control and public health, and I want to thank all of you, and signing off, and hope you all have a great rest of your day. Thanks so much. Bye.
Thank you. Bye.